Nigeria has placed its capital Abuja and 6 other states on high alert following the emergence of the Delta variant of the coronavirus in the country. The Presidential Steering Committee on COVID-19 says that the number of new cases and hospital admissions has continued to rise. The committee says the 2 most populous states in the country, Kano and Lagos, are among the 6 places which are worrisome with early signs of the 3rd wave of the pandemic. So far, nearly 170,000 cases have been confirmed, with 2,127 deaths. Meanwhile, Nigeria expects to receive nearly 8 million doses of the coronavirus vaccines, including some donated by the United States by the end of August. Well, for more on the coronavirus pandemic in Nigeria, we're now joined live from Abuja by our correspondent, Phil Ihaza. Phil, thanks very much indeed for joining us. This Delta variant, when was it first detected?
Well, thanks. It was first detected on July 8th. That was the beginning of this month by the NCDC, and according to the Center for Disease Control here in Nigeria, they said that it was discovered from a routine traveler. Of course, the details were not given, but as at that time, it wasn't so much of a big deal because at that time, we were still witnessing very low cases of infection, and so that was the first time, beginning of this month. And we've seen rising cases since that time. For example, 5 weeks ago, we used to see a case of maybe 1 or 2 cases a day out of over 200 samples tested. 2 weeks after that, it rose to about 13. A week after that, 30. And as I speak to you, just over the weekend, we're over 100 cases now per day. So that tells you, of course, that it's a cause for concern.
So what does high alert mean? Does that affect it in terms of restrictions, movements, or is it just that there's a warning and it may escalate?
Of course, the red alert is something that the government has warned or directed that people should take seriously, because one would expect that after the red alert, if we still continue to see cases, new cases of infection, positive cases of COVID-19, the government will have to take it a step further, a notch higher, to maybe lock down some areas. For now, the government has thought it wise to put those red alert, those restrictions in Abuja, the Federal Capital Territory, and 6 other states, like you rightly mentioned. And that will also mean that major centers for gatherings, like recreation centers and parks, will be closed for now, because they're trying to restrict the number of people that gather at once. That is also coming very timely at a time where the country will be having a public holiday on Tuesday and Wednesday to commemorate the Salah celebrations of the Muslim population in Nigeria. So the government knows and has taken a step further to place that restriction on those places, and also instructed religious leaders to reduce the number of people that come into the worship centers to pray at a time, and also reduce the duration of such a fellowship. So that's the position of the government, and it's coming at a time when the cases are rising. They don't want it to escalate, so that they don't have to place a further restriction in several parts of the country, because of course the economy is still recovering from such restrictions that took place last year.
What is the situation in terms of travel in and out of the country? Because Nigerians are amongst the most traveled people in the world. I guess it was just a question of time when the Delta variant would arrive. Hello, Phil, can you hear me?
Sorry, Peter, you might need to take that question again. I'm not sure I got that clearly.
All right, I was just saying that...
okay, I can hear you. Please take it again.
All right, I was just saying that I guess it was just a question of time, and I was wondering, in terms of travel in and out of Nigeria, what is the situation? Nigerians are among the most traveled people in the world. Was it just a question of time before the Delta variant arrived?
I'm not sure I got the question clearly, but if I can deduce from what you asked, you're saying the Nigerians are one of the most traveled people in the world, and it was just a question of time for this rise in cases or the discovery of Delta variant to be discovered. That's not surprising because if you look at the fact that several months now, the government has actually placed a travel ban on some countries, including South Africa, India, Turkey, Brazil, and a host of others, to try to restrict any form of entrance of this people coming in with suspected cases of the variant. That was only a matter of time. They could manage that, but now we've finally discovered a case, even more than that as at the moment, and the hopes are that the government can manage this situation, considering the fact that this is not the first time they have managed an outbreak like this in Nigeria. So that's why they're taking these steps now, especially with the states who are most affected by the new cases of infection.
So 169,000 COVID-19 cases. I mean, is that believable given a population of just over 211 million? South Africa has got a population of 56, 58, 60 million, and we have recorded 2.2 million cases of COVID-19. You can see the maths is very different. I wonder if it's just an issue about testing.
Of course, to a large extent, it has to do with the number of testing, the frequency of testing, the fact that in this part of the world, a lot of people are still having to struggle with their belief system, cultural beliefs and doubts about if the pandemic or the coronavirus disease is actually real. And so they either do not turn up for testing or they evade such processes and rather try to deal with whatever symptoms that they find. And so all of these, of course, will play a larger role in the fact that Nigeria has not recorded so much of cases compared to the population. I mean, Nigeria has the largest population in Africa, over 200 million, and to say that we have just about 169,000 cases, of course, to a large extent, it's not exactly believable, but the NCDC has said that they've done their best to do as much testing as possible, and so far, if you look at the fact that the cases have been managed compared to the number of cases found and the deaths recorded, you would also want to believe that for several reasons the country has done so much in managing the casualties, and so that's the reason a lot of people in some quarters are believing that figure. But if you look at the processes of, like you said, testing and a couple of others, the fact that people here, a lot of them are not responding to the protocols. Yes, you might say that more testing needs to be done. More cases might even be unreported at the moment.
I suppose a key indicator is the number of hospitalizations. Is that something that's increasing, and are you starting to see or sense that the healthcare system is under strain?
So at the moment, with regards to COVID-19, the hospitals are not, they're not overwhelmed by cases or patients, going down with the symptoms of COVID-19. Rather, you'd hear in some parts of northern Nigeria reporting cases of cholera and other cases, especially with the rainy season, the hygiene problem and all of that. So for COVID at the moment, because like I said earlier, 5 weeks ago, there were days where we went just one case, reported positive case. There was even some of the days, I think 1 or 2 in the month of June, where there was no case reported, even if there were samples tested. So, but the government has said that they have already kickstarted or reopened the emergency response centers, especially in these places where red alerts have been placed. There's also the efforts to revamp the isolation centers, keep them ready for these new cases that we're beginning to see, the rise in cases, so that we don't have an outbreak in our hands and difficult to manage. But for now, the hospitals are not overwhelmed by these new cases of coronavirus, because we still have the template in place like we did before.
All right, and how's the vaccination rollout program going?
So for vaccination, the government has said that it's expecting another batch of vaccine in the month of August or before the end of July, and is expecting about 41 million or thereabout of vaccine coming in September, because it's trying to increase its efforts to hit its target of vaccinating 40% of its population in 2021 and an additional 30% in 2022. That's achieving a 70% herd immunity for the entire country. And so far, with the number of vaccines rather that the country has received, which is about 4 million, the NCDC, the Ministry of Health authorities, they have reported that they have done quite a huge number of vaccination, about 3-point-something million so far, which means that a lot of people have gotten their first and second doses, and they've kick-started the first dose again for the AstraZeneca vaccine. So we're a little behind with the plans, and that's understandably so, because the pandemic took another level in several other parts of the world, and that slowed down the arrival of vaccines to the country. But recently, the health authorities, that's the NAFDAC, from the NAFDAC agency, they've approved for more vaccines, more variety of vaccines to be used in the country, not just relying on AstraZeneca. And so we're going to be expecting more vaccines, which will skyrocket the level of giving jabs to the populace. So the only part where some health experts are saying the government will need to do is to do more in sensitizing the people to understand why it's important for them to take the vaccines, and also, go to rural areas and ensure the health officials can access those places to increase the vaccination campaign.
Phil, we're going to leave it there. Thank you very much indeed. That's Phil Ihaza, our correspondent in Nigeria's capital, Abuja, talking about 6 states that have now been put on high alert because of an increase in COVID-19 cases, particularly with the arrival of the Delta variant.